Nobody knows, but normally not because it's mostly for fish based. But virus always, we talked about spillover, right? So over the generations, you are eating and the virus is there, and then what happens, you don't know. So, but it is, that's why the salmon is
You are
very
eating and
important
the
fish.
virus is there.
That's why they want to see
What happens,
you
you
don't
don't
know.
know.
So, echoing. Oh, fixed. Okay. Okay, so we end up with a hepatitis A. I don't know these slides or not, but the pointer will not work because it is glass. So you can see there are mostly the hepatitis A is more prevalent in Africa as well as Asia. So Africa is more endemic, you can say like endemicity, so it's very high, and it's mostly affecting in the early infants in the Africa, but in the Asia it's mostly late infants and youngs. But what hepatitis A does, based on the name, you can say hepatitis means it's affect the liver. So it's a liver disease, and it is transmitted through ingestion of contaminated food and water through direct contact with an infectious agents. Mostly everyone recovers from these viruses with a lifelong immunity. So if you have that, you'll definitely lifelong immunity have. Very small proportion of the people infected with hepatitis A could die. The risk of hepatitis A infection is associated with lack of safe water. So if the water is contaminated, if the food is contaminated, that's mostly the source of transmissions there. So, but the good thing is an effective vaccines is available. So there are effective vaccines. No, it's, yeah. Oh, no, it's not touchscreen. So, so here is the list of the categories of person with increased risk. So definitely those persons like caretakers and sexual contacts happens, occupational risk, people working with non-human primates like monkeys. Monkeys are one of the reservoirs. Person with clinical, non-clinical samples. Drug users, chronic liver disease already have the hepatitis B, hepatitis C, those things. Fatty liver disease is another disease, mostly happen, people are drinking alcohol every day and it generates that disease. It cannot be recovered until you do liver transplant. Alcoholic liver disease, autoimmune disease, and other infections if you have a co-infection like HIV, other chronic diseases. So there are a lot of available vaccines already, so which is good thing. I don't know you guys have a hepatitis A vaccine, but 2024 India has made that in-house heavy sure vaccines. It's from I think Hyderabad company. They made that vaccine, but earlier they are importing those vaccines from Merck or Sanofi. But all of them are very effective, and some vaccines you have to take two dosages. Some has to one dosage because live attenuated is always, it's very effective. Like measles, one dose is enough. But if you are using inactivated, then you need to boost your immune system. So, but if you take the vaccines, if you don't want to take risk for hepatitis, vaccine you are good to go for the rest of your life. So, but if you get an infection, there may be a chance you may damage your liver, those things. Okay, so another important virus is the norovirus. I think it works from here. So the norovirus is isolated, very old. It's 1968, non-enveloped single-stranded RNA virus. It is very common, throughout the world. Norovirus is present. It's mostly affecting the gut. So you have a diarrhea, so you can see the symptoms. It affects in the gut. It's also contaminated with the water and food. Very common. Diarrhea, vomissions, nausea, stomach pain, all those things happens. Do you remember the slides I have shown you yesterday, that 1 of 9 in India from the ICMR report has the infections, either dengue, hepatitis A, chikungunya, and flu, right? Some of the major there. So this is another one. Norovirus is very common. It's a different virus, yeah. But it causes mostly gut infections. You can see the mortality rate. Like 2016, they reported more than 19,000 died. So very severe. Okay, so there are a lot of vaccines are under trial. There is no kind of approved vaccine yet, but you can see, like, for all vaccines, you have to go to clinical phase 1, 2, and 3. You can see that bivalent vaccines, which are under trial, the color codes and everything showing what kind of virus it is. Like here, it's mostly subunit vaccines. So this is a subunit vaccine. We'll talk about subunit vaccine, what is it? It's on day 5, okay? The different categories of vaccines are there. But just remember, like, those vaccines are under process, but not fully approved yet by the FDA or others regulatory board for the use of human use. So it's still under development. Only the prevention, the simple thing, wash your hands, make sure you're clean, and shellfish. Shellfish is another fish, that contains a lot of bacteria because it's very dirty. United States, people love shellfish, right? Like, when he was in Tulane, it's in southern part of United States, they have a festival called Crawfish Festival. Crawfish is another shellfish. So the head is this big and the tail is that small. And people take a plate and like this kind of huge pile of shellfish they eat like several, like some people eat like 5 pounds, 10 pounds, like this huge. But you cannot eat the head, right? So you just take the tail part and eat, and it smells so bad. And after eating, if it ferments and get bad, then it smells bad. So you have to trash properly, otherwise it smells for several weeks. But it's very tasty. Initially I never tested it, and then some of my friends says, "Oh, test it." But it looks ugly, but it's a shellfish. My point is, like, shellfish contains a lot of that kind of organisms which causes your gut. So if you don't cook properly, and if you travel somewhere internationally or some places and they offer you shellfish, make sure those shellfish are well cooked. That's why those crawfish, they just boil it in a huge container there. It's water is boiling. They put it there. They put garlics and different spices, and let it boil. And then after like 15-20 minutes, they take it out and eat. So most of the things like that to control those kind of contamination, what shellfish is bringing in, norovirus is one of them that they're very rich on. So yeah, mostly preventive measures, like, as I said, hepatitis A, all kind of hepatitis A, B, C, D, all those hepatitis, you have to make sure you are maintaining hygiene. Street food, the vendor who is selling the food, do you know he has hepatitis A or so? We check? Maybe not. So that's kind of thing you have to be careful when you are eating vendor foods or street food and all those. And that's what happened, like, you easily get contaminated with those food. So you have a question, sir? Somebody raised a hand question? Okay.
About Hep A itself, I know we moved on, but what is it that actually affects the liver about this virus? What's the prognosis of it?
So hepatitis A is so bad, sometimes you have to do liver transplant also, because it damages the whole liver. So it causes cirrhosis. Cirrhosis means, so the liver is such an organ. it can generate itself. So, if you cut the liver, take something, liver can modify. That's only one organ you have in your body that it can regenerate very fast. If the liver stop regeneration, that means it is bad, it's not working well. That happens, this virus stop the regeneration. So the liver cannot, the dead cells, it cannot fill up with the new cells. And then the major part of the liver is to purify our whole blood. Yeah, and it's a toxin, both kidney and liver, what they does, purify the blood. So all the bad things goes to the kidney in purify and all those. So if the liver functions, then you have toxic syndromes, you can get a shock and all those, and you may die. So that's why, especially the children's, some children has to go liver transplant, otherwise they are dead. So.
Does it cause jaundice as well?
Oh yeah, same. You'll see your yellow hand, you have loss of anemia because red blood cells also coming from there. So you lost red blood cells and you die eventually. So. Okay, next slide, please. The next folder. This is the end. Okay, so this is the Crimean-Congo. This is very interesting disease, and it is everywhere in India. This is another BSL-4 pathogen. So today, we are talking BSL-4 pathogens, okay? And probably you have seen the videos, BSL-4, how pathogenic it is, because there is no vaccine. So BSL-4 organism has no vaccines, no drugs, anything. So if there is outbreak, you should be very careful. For that disease to handle, you need a special lab, BSL-4 lab and all those. DRDO in Gwalior, they are studying this. My friend, we sometimes talk about, we're trying to collaborate on this. It's not moving. Okay, so Crimea, that's the name because Crimea and Congo, there are two countries that first thing they happened. So 1944, and DRC is the Democratic Republic of Congo, both in Africa, 1956. So the invention happens like, I think Crimea is in the Russia, Crimea, Russia, and then Congo is in Africa. Okay, so outbreak happens. So then they have a fight in between how to name the virus, because who invented first, right? They want to get credit, right? So, but DRC also happened that time, but they have not characterized, right? You have to characterize fast before you claim it. The same thing like somebody asked, or I don't know, the audience asked like, oh, you asked, Dr. Reddy asked about Robert, that guy who also, Robert Gallo is also invented the HIV. Why he has not got Nobel, right? Because he has not properly characterized the virus. That's why all French guys got the Nobel Prize. Same thing like the Russia first came like 44, and then say, oh no, the virus should be named Crimean-Hemorrhagic fever. But the Congo, the African, they also discovered the same year, but they have not characterized until 1956. Then they have a discussion and all those. They say, okay, put both names. So then it came Crimean-Congo. The interesting is the tick-borne. It is transmitted by tick, and also other vertebrates do not become sick. Only it is very dangerous for the human. There are small outbreaks happens, less than 100 cases. They are vertical transmission. It's not known. If the mother is infected and baby will get it, we don't know. It's the same Bunia virials family, probably you have seen yesterday, Hunter virus we talk about. It's in the same family.
How often do ticks actually infect humans? Because I've only seen them in animals, pets especially.
What?
Ticks, as in how much do they affect humans? Because I haven't seen.
Yeah. We'll come in the next slide. I'll talk about ticks. It's not moving. Oh, okay. Okay, so okay, so the virus replication is similar, like because it's the same family. Okay, and you can see there's 3 circles you saw last time, right? So they have like a segmented genomes which are circulated, and like large, medium, and small. And they have similar like proteins they generate, like which we discussed yesterday, like hantavirus. The replication is same because the same family, and this is enveloped viruses, tri-segmented negative sense RNA. So the same thing happened. It goes through endocytosis. Again, endoplasmic reticulum is important for making those secondary, the non-structural proteins. And the virus, the negative strand RNA goes to the nucleus, makes copies for complementary positive strands, so all the structural proteins formation happens. And also it makes the complementary so that the negative strand also happens. And oh, good. So I can change slides here?
Yes,
From?
we'll check once if it is possible.
Okay. Then it will be good. I don't need it.
Very sophisticated, but
How are you? So this is next. What is that?
it's to go back, I guess.
So it is the same like cycle what we discussed. Then it goes, so when it's replication happiness, then it goes to the Golgi apparatus, which is kind of packaging assembly. There is another virus I'll talk about later. They modify the host transcription factors so that they can change themselves. So the virus is so smart. They stop host translational modifications and then take their mechanisms to translate their own viruses mechanisms and then make the new viruses. So that's the Kaisener forest disease virus I'll talk about later.
I have a question for you.
Yeah,
Cocktail vaccines are available for because
like MMR.
but chimeric walk in the same kind of activity. So possible to design such a virus so that you don't need to prepare for each against each virus. So you can
Right.
combine them.
So
Huh? Cocktail is only for that viral related specific species. Chimeric means you incorporate parts of different viruses.
so that's the thing. That's the new ideas came. So especially in the flavivirus. So what the idea is coming. So can you make a pan filovirus vaccine? Okay, pan filovirus and make a recombinant vaccine so it is expressing all the virus, like a protein, and just give one vaccine so it will like so many they funded a lot of money on those like generating pan filovirus.
Vaccines could be designed like
Right.
that. Lots of mRNA for each
Right.
virus and then express them as a proteins or peptides.
Exactly.
Having antigenic epitopes which are immunogenic.
Yeah.
Then that was but I don't
Yeah. So that's the concept is. Yeah.
Maybe looks like in theory or in principle it's doable.
Yeah. That's under trial now. So. So yeah, then after that, the virus release, from the Golgi. Okay, it came. Okay, it is delayed. Okay, there's a delay too. You never said that. Okay, pathogenesis. So human experience several hemorrhagic fevers. So it happens local replication at infection sites, blood and lymph spread to major organs, especially the liver. The so once its replication started, it's mostly it's in the blood. It goes to the lymph node, as we all know. It's the major lymphoid target, and mostly the lymphocytes, the phagocytes, endothelial cells, where mostly endothelial cells are remain in the blood vessels and all the blood vessels. Limited damage to phagocytes along the depletion of lymphoid cell by a suppressed immune response, allowing increased variety. The clotting happens inside the brain blood vessels due to platelets accumulation, due to the neutral throughout the blood. A lot of clots happens, and that may damage. You may get a heart attack, or it may damage any other major organs because the clot can go to the tissue. So that is also happening here. So DIC is very common. And as the DIC happens, so the platelets count in the blood is go down, and platelets count is very important. If the platelets count go down at certain level, you can assure that the person is see, and one of them, my major count, they say platelets count, because platelets go down means they say, okay, you have two. Right. It's going inside the tissue, either it going to the tissue or it's in the blood vessels. It generated already a lot of clots, and blood vessels are there. So if the kidney does not get blood, gone. Liver cannot get blood, gone. Well, that's why that's why they measure like platelet counts. Then when they say platelets count suddenly go down, that means the doctor can easily predict, oh, there is a clotting happened, because platelets suddenly it was like several thousand, right, and it came down to 2,000, where all the platelets goes. And then they say, okay, there is a clot already happened. And then they give a lot of injection, like a clot removing factors. There are some medicines there. They try to inject, coming back. Another thing like they do on also like blood transfusions. There are only platelets they transfer, not the other cells, just the platelet transfer. Severe condition patients where the platelets went very low, they are in the life-saving mode, then they have to transfer platelets getting from any donor, because platelets are not, you can take from anybody. It's not like not type specific, right? So you can take platelets anybody and just give the platelets. It is very common in all the developed countries. I think here too, like accident happens, you say platelets going down because they generate clots or those things. Yeah, question.
How is it that hemorrhage and clotting is happening at the same time?
Yeah, so if you remember, like DIC, what happens? So it breaks the tight junction protein, like cadherin is the tight junction protein. So the virus somehow will stimulate another protein which breaks those addition molecules, those cadherin proteins. So there is a gap. So your blood vessel, all the tight cells are there. So all endothelial cells are tied together like this. So if there is a gap there, blood is flowing, right? So they'll get a leak. and come out. And then you can see, oh, why my skin is getting red? It looks patchy. I'll show you some pictures. So blood is coming out. And also, so because the blood is coming out, platelets, what I should do? Again, block it there. So they try to go all and make it a layer, like a patch. Like, you have a hole in the pipe. What do? Either put a thread or something, or any clothes. You try to cover it because it's then until you call the plumber, right? So that's the same thing. The platelets kind of like thread. I try to cover it and stop the bleeding. And as platelets are moving that direction, so total circulatory platelets go down. And that's why you have a platelets count go down, because all platelets are there to stop those bleeding.
The clotting is happening because to fix the
Yeah, so it's condition, right? So the addition molecule leaking happening, platelets came in to block those blocks. As platelets are doing those, their count going down. And also platelets are doing this, they are generating clots too. So it's a mess up situation, and so that 88% of the infection are subclinical. Press hard and long. Okay, it works. Okay, so this is the incubation period is 3 to 7 days. Okay, the nosocomial means when the infection happens in the hospital situation. Okay, nosocomial, that's the terminology they use, nosocomial. So if it is a hospital mediated transmission, then the incubation is very low, but it normally is 2 to 12 days. And all the symptoms, like, we discussed about hantavirus, headache, dizziness, nausea, all those things are very common in viral disease. There will be fever. We mentioned biphasic fever also in hantavirus. Here also same, like you have the fever, then you become normal, and then after certain days you have the fever. Hepatomegaly, your liver will be bigger. 50% of cases, you can, that doctor will press your belly. They want to touch it, how your liver is. And if you say, oh, I have a pain here, that means you have a liver become bigger. 50% cases, that's the doctor mostly, touch your belly and test. So that's mostly they are touching the internal organs, whether there is any pain or not. Altered consciousness and all those shock, liver failure, that's the end stage. And illness will normally range from 5 to 20 days, and convalescence, so it come back to 4 months. Okay, so that's your question, how the ticks goes. So the farmers go to cut the crops and all those, and there are a lot of ticks there. I did nothing. Okay, so this is the incubation happens when the farmer is cutting the grass or taking out the crop, and there are a lot of ticks are there. Ooh. What is happening? A lot of ticks there, and they're biting. They got the bite, and then pre-hemorrhagic symptoms starts, like what we discussed, like flu-like symptoms. You're getting chilly, melisy, body muscles are paining, you get vomition on all those, and then you have a hemorrhage, because that's moment the virus is already have a high virus replication, and then it's going to DIC, right? It's breaking those blood vessels, and you can see you have like a red patch in the body. And then the person is recovering because he will be hospitalized like 2 to 3 days or more, and then it takes months when you come back normal. And that point you have generated your antibody automatically, because the body immune system's kicking in, and then you have this. But the long-term sequelae we don't know, not how it studies. The sequelae means what? You have the Crimean-Congo, and from have seen, you probably the COVID, right? People have still things, oh, I have like mental fog. I have COVID before, but I sometimes feel mental fog when I drive or do something. So that kind of sequelae, or what are the other side effect symptoms, it needs more study to see in the long run what is happening. maybe not. Oh, normally the ticks bite, they have some kind of, somebody said like, we worked on the tick also, the Lyme disease, also a tick borne. Depends. People feel it, some people don't feel it. Because the tick also releases some kind of analgesic kind of thing. It's not like mosquito, you can feel it very, very hard. But the tick is different. And, the tick bite happens. Is So, but you can see that's a picture showing like how the hemorrhages happen, and you can see all the hemorrhages because the blood vessel leaked, and you can see all the like a purple or blue or bluish reddish color happened, and the hemorrhage is very common. And it's for 3 to 6 days post onset, like petechial rash and trunk limbs, conjunctival injections, uh, and congestions of pharynges, soft palate, bleeding can be profuse, hematomas, ecchymosis. Those are the terms medical doctors use. It's a medical term. Bleed from the nose comes. We discussed about like hemorrhage. Somebody asked like, hemorrhage happen from anywhere. When you're urinating, you can see blooding coming out from your gum, from your nose, from your ears. Those are common. So this is some example also like that the guy's tooth, bleeding, and sometimes your skin has ruptured and you have bleeding. Conjunctivitis, your leg, you can see those kind of reddish things there too. So the diagnosis is, exposure to ticks and animals important. Okay, so major people do the to do some kind of multiple PCR to see which strain is this. Because there is difference in the strains too. ELISA, we discussed so many times. We'll talk little more about how the ELISA is done. I don't know anybody has done that kind of assays, but we can discuss in the day 5. Cell culture or suckling mice, there's another model to isolate. If the virus is very low, always another diagnosis is to grow the virus more and then characterize. So that's why cell culture, people just grow the virus more and do it. Suckling mice also, you just infect the mice. If it is 1 or 2 virus, the mice will multiply inside, and then you isolate the virus there. So viral RNA and antigen usually detectable within 1 to 2 weeks after onsets, because the virus is very low, you cannot do early detections. The antibody mostly come very late, like mostly, the previous slide saw the convalescent stage when the antibody, so the antibody comes very late then. Okay, so this is kind of a diagram like how the viremia happens, and at that point you can see the RNAs from those viruses. If you do, but the early time point may be undetectable because the virus is low, the multiplying. So when it is virus high, maybe you can see it will take 1 to 2 days to see that viruses. And then IgM comes first and IgG comes first, and then ELISA you can detect a little later. So the treatment is standard supportive therapy. There is no vaccine yet. And early aggressive intensive care support, those careful monitoring, because there is a lot of bleeding, so that you definitely need, the patient should be getting some oxygens, their loss of blood, so definitely fluid electrolyte balance. So loss of blood, also blood pressure you have to monitor. Sometimes you need to give the blood, those things. Pain management, and those things. I mean, it's all symptomatic treatments to just survive those patients. So there are some drugs has been tested. None of them is very effective. Some works early time, some works late time, but a lot of those, there are no specific drugs. We talk about repurposing, right? It's several drugs like ribavirin, okay? Ribavirin and flavirabin is all used for influenza viruses. So they tried also like 2-deoxy-2-fluorocytidine. It's mostly used for cancer patients also. The monoclonal antibody has been tried. Corticosteroid is always used for everything, right?
Why would you give corticosteroid? You want to remove the tuberculosis.
Well, corticosteroid because there is a pain, right? So that's why they want to subsidize the pain and all this. It's not a monotherapy. More preclinical clinical studies has been done. Corticosteroid also immunosuppressive, but also you have to see, it's better to give to reduce the cytokine or work on the because initially they say, oh, there is a lot of pain and all those. That's why they gave like, okay, give the corticosteroid, inflammation go down. We'll think about because antibody anyway come in very late. It may have some impact if you give, but
Keep the patient alive till then.
exactly, yeah. So that's the one to do because initial shock is more important. Like if initially, if you have like the IL06, which is one of the important cytokine for COVID, it increased so high. So people do other medication to reduce the IL6. People are not thinking there, oh, what will happen long term? Well, that has some impact, but initial is more important. So I'll always like, if somebody has diarrhea or somebody is doing, we always give, okay, take electrolytes. We don't think, okay, I'm giving electrolytes. Is that makes some excess electrolytes may cause something damage? No, we are not going that direction.
Talk later. Let's
We'll think later, yeah. So that's, body can recoup all those, extra thing. They will eliminate through the kidney, through urine. Body has that defense mechanism. So we should not think too much those things. Body will take care of it. If I have taken corticosteroid,